All right, so it looks like we are live. Good afternoon, everyone. Yours truly, Dr. Barry Pierre here, favorite board certified internist, founder of drbarrypierre.com, the host of the Lunch Learn with Dr. Barry podcast. Most importantly, the moderator, host per se of the Empower Yourself for Better Health series. This is episode 68, where we talk about all medical, public health, social health related topics here on the broadcast. And we today is Saturday, beautiful Saturday afternoon, and we are practicing our social distancing in my house. I'm actually upstairs. My kids are downstairs eating lunch, so I'm trying to do this live stream before they come up and run amok here. We are actually live on multiple places today, right? So we are doing live on looks like my personal Facebook page, my professional Facebook page. We are in the Lunch and Learn with Dr. Barry group page. We are on YouTube live as well as Periscope. I'm not sure if Periscope goes to Twitter. I'm not sure how that actually works for Periscope, but we are going live in all of these different places. Why? Because I thought it was very, very important to be talking about such an important topic, such as the coronavirus is this global pandemic. Now, if you did not get a chance to catch episode 67, especially for background purposes, because we won't necessarily be talking about what the coronavirus is. I did that in episode 67. So catch that. Go to drbarrypierre.com/episode 67. And it'll take you right to that YouTube page where you can get a nice little background update on what the coronavirus is, or you can catch my guest appearance on That's Absurd podcast, where I also was talking about what is the coronavirus and why we should be very afraid of it. So I want to kind of do some quick reminiscing, right? So on March 12th, that's when we actually did episode 67, right? We were kind of in the beginning stages of kind of really understanding what this virus was and what it was going to do to really our global perspective on healthcare and the way of life as we know it, right? Like that was, again, March 12th. Just to kind of give you some numbers of what was occurring around March 12th, right? On March 12th here in the United States, at the time we had 968 cases of coronavirus diagnosed, 968 today, right? And again, we're gonna talk about what the numbers are today. It is much more. And as a hospital physician, as a program director at Wellington Regional Medical Center, being on the forefront of not only on the front lines of being in a hospital, taking care of these patients, but also being on the front lines of the education and having to educate residents during this time as well, too. It's definitely been a lot of changes, a lot of things we've kind of had to throw by the wayside, unfortunately, to really kind of deal with the reality that this virus was causing on our whole society, right? Basketball, football, all of these sporting events canceled, conferences canceled, right? Again, we were practicing when social distancing was not even a thing until now, right? Like a lot of things have happened since March 12th, right? And I can tell you, if you go back and you catch March 12th episode, I talked about the foreshadowing that was to come. But even I was surprised at the rate that has happened here, especially, and we're going to talk a lot about the United States and the effects on the United States. But I want to kind of first start talking about what the experience is, what the experience has been as a hospital physician, one who has to take care of patients who end up in a hospital. Unfortunately for some, not all, right, but for some, end up not leaving the hospital. When we first did our initial video, we talked like, hey, this virus is here to stay. It's going to be some issues, definitely something you're going to need to be wary of. We first initially talked about, what it was going to do to the hospital setting, right? Like, what is it going to do to a patient who comes into the hospital setting, and you have to decide whether this patient has this disease or not, right? Especially a disease that if December 1st, 2019, we had no clue what it was, right? Allegedly, right? No official first diagnosis was done on the 31st of December, right? 2019, right? Just to give you an idea. So December 1st, we didn't even know this was a thing, right? Until now, right? Until now, where the numbers again are skyrocketed. We're gonna check CDC site just to kind of give you an idea of how much they've skyrocketed. We're gonna talk about, I'm in Florida, I'm in South Florida, but we're gonna talk about Florida's inept response to this virus and how I think that's gonna again, hate to be blunt, right? That's gonna kill a lot of people, right? That's just because here in the United States, we acted slow. We acted just as slow in the state of Florida, right? So I think a lot of things are going to happen that we're not even, like I said, it's so early, right? We're just getting into April. We're going to be talking about this in the summer. We're going to be talking about this in winter, right? Just to give people an idea, like this is something that is not going to go away by summertime, and everything's going to be kind of kumbaya. So here in the United States, we have, this is cold and flu season in and of itself, right? This is typically one of the busier times to be a hospital physician. This is typically one of the times where we're seeing patients who, are coming down with the flu, coming down with pneumonia, coming down with all of these respiratory related issues already, right? COPD, asthma already. Like that was already happening during this time season. And now you add this virus that looks like all of those. And you have, and especially unfortunately, because, our response here in the United States was so terrible. You have us not as a hospital being on the front lines, you have us not even having the ability to really adequately diagnose them in a proper way. So it got to the point where, again, when we first started a hospital setting, it was like, something to think about. But then when we actually had to really start looking for it, right, we had to say, what used to be, our surgical ICU, that's going to be where we're going to just keep our patients that we're ruling out. And just like it's happened in all hospitals across the country, that area was too small. And then it started having to trickle out. So, maybe we'll just take this half floor, and that has become too small. Well, maybe we'll move some patients out of the ICU. Now that's becoming too small, right? So and again, we warned you, right? Like we kind of, this, especially episode 67, I kind of talked about how this number was going to go up. And I'm pretty sure you guys have seen the graphs. You've seen them out there that say, flatten the curve, flatten the curve. This is what we were concerned about. We were concerned that we would get to a point where this bottleneck formation would occur, where we were going to have a lot of patients we were going to have to take care of. And we weren't sure if this was just a regular pneumonia, the regular flu, or the virus that's so, the ability to spread, right? We're not even 100% sure, but we know sometimes in the air, sometimes it stays on my phone, may get in my hair, like all of these things that occur. We know like all of these things are kind of happening, kind of all at once, right? Like how do you again, the difficulty preparing for a virus that can do all of that can be asymptomatic, aka no symptoms in people, but still give it out, just like the flu does, right? But still give it out for up to 2 weeks, right? The difficulty of being able to train, you don't train for that, right? Like that's something we have to learn on the fly, and that's what we're doing here in a hospital setting. Trouble hearing you. Oh, that's my no pay Siri, no mind. That's what we're having trouble dealing with now, right? We're having trouble dealing with trying to distinguish whether this patient is a patient who may have the virus or may not have the virus and is just also sick. Because again, the sick people are still coming. People are still having heart attacks. People are still having strokes. People are still having seizures. People are still having infections and everything else that was going to bring them to the hospital anyway. Now you have to add on this aspect here, right? Like it's definitely extremely concerning, right? And when it comes to testing, right? Because again, that's probably the most question I get a lot. Like, oh, can I get tested? Can I get tested? We don't even have the ability to test everyone. And when you see and again, I'm going to talk later, when you see what the numbers have jumped up to, and we're still behind on testing people, like I think a lot of people should rightfully so be worried. Again, I'm pretty sure if you went to a grocery store, you've seen that all of a sudden you can't get toilet paper. You can't get paper towels, right? You can some places you can't even get meats, right? It's gotten that serious in that regards, right? And that's really the problem at hand with this virus. And being in the hospital setting and talking to my environmental service workers, talking to my nurses, talking to the administration office staff, talking to administration in general, talking to everyone who is right there, who again doesn't have the best answer, right? Again, I get residents all the time who bring up like, well, hey, I have a cough, I have a cold. What is this? Do I have it? And I say, you may not. I don't know. And I'm seeing your question. I'm definitely gonna get to your questions. The question becomes like, again, we can't physically test everyone. Even if we wanted to, we couldn't physically test everyone because the supplies aren't there. The timing isn't there. And especially, and this is definitely, the timing is really going to be a regional issues. And when we talk about it, for example, here in South Florida, right, there's a couple of tests. There's a test that if I send to, one of the labs that we're contracted with, it may take up to 7 to 10 days, business days to get, right? There are other tests, right? Like if I send it to, like, especially the state of Florida has their own test, that may take 2 to 3 days to get with, right? And then someone in the comments actually asked, what about the 15-minute test? And that's a very good point. So for those who may not know, Abbott Laboratory just got FDA approved for the rapid test, right? And by rapid, that means 15 minutes. But the problem is that test, like, for example, let's say you have 2 people who come in your office at the same time and want that test. Even if you had the machine to test those 2 people, you can only do it 1 person at a time, right? So it's 15 minutes, and then the next 15 minutes you go. And it's a limited supply of the ability to test, right? So it's not like there's not an unlimited supply of things out there to test. Like, again, and I don't want to get all technical, but there's not even an unlimited supply of those type of testing agents to get the 15-minute testing, right? So now they're having to ration out like who gets the test and which facility gets the test and how many of those tests they get. And again, that's what happens, right? What happens as you're waiting in the hospital setting? You're put in isolation precautions, right? As you're waiting, your respiratory precautions. As you're waiting, nurses and physicians and environmental staff are having to wear masks and gloves and gowns and all of these things here while we're waiting for the test. I have patients who, they may have pneumonia. And there may be certain, or COPD, and there may be certain remedies that if I just thought it was a COPD, I can treat and keep it moving. But because I have to worry about this may be the virus, I can't even give you the typical treatment course that I would normally get, right? So that's how much this is really affecting the way that we are practicing medicine, especially in a hospital. You guys know if you have outpatient doctors, your doctors aren't even letting people come to the office, right? A lot of these offices are closing down. A lot of these offices are doing telemedicine. Why? Because I can't risk bringing someone who may have the coronavirus into my office and infect everybody else, right? So you're going to see this virus is going to cause a lot of changes to occur, for years on end. As a program director, taking care of residents, we have a governing body, ACGME, and they actually kind of, essentially create the rules. And, they're even giving us leeway to say, hey, you know what? I know we typically say you have to have these certain rotations before they can graduate. But we're going to let that go, right? We're going to say you don't need to have those rotations because they need to be on the front line. So you have residency programs that are, putting, residents out, taking them off certain rotations, putting them on certain rotations that need more help, right? Again, our ICU, the numbers are doubling, right? The size of ICU related patients is almost doubled and is going to continue to get worse as this goes. And again, this isn't just a Wellington regional thing, right? This is happening all across the country. And again, we're pretty well maintained as a hospital, like as far as the amount of resources we have. So I can only imagine these smaller hospitals who don't have the level of resources we have. I can only imagine what they're going through. I can only imagine. Fortunately for us, we're not dealing with a supply issue, right? I have the mask, I have the gowns, I have the gloves, but you just have to read social media, right? There's a lot of people who are dealing with some of those problems where they can't get them, or they have to share them, or they have to hold them for a certain number of days, right? So that's a lot of things. Again, this virus has really changed our way as far as how we're taking care of patients, how we're educating patients. We've went away from even doing noon conferences in the hospital. Where our residents would go and have lectures. We went away from that, right? Because I can't have all of my residents in this small confined room because the chance that one of them may have it is high. Why? Because they work in a hospital, right? So I can't have them affecting the whole 18. We have 18 residents in our program, so I can't have them affecting the whole body of residents, right? So that's definitely a problem of concern. Someone asked, what about vaccines, right? The issue is that the stage of creating vaccines is still very early. In a normal, non-global pandemic state, vaccines usually take about a year and some change to start seeing some results. One, positive results, and two, to make sure there aren't really bad negative results. But of course, unfortunately, in this global pandemic, a lot of things are being sped up. So you're reading about a lot of vaccines that are being worked on, that are being created, that I couldn't even tell you what are going to be the side effects in a year or two, because we don't even know. That's vaccines usually take that long to produce and create and make sure they're actually safe. But we're dealing with this global pandemic where we're kind of speeding up the process, and we're letting patients, especially once it gets to that stage, a lot of the discussion when it comes to vaccines is going to be like, hey, I'll be honest with you, I don't know all of the side effects that can occur from taking this vaccine, but here's this vaccine, right? And the patient is really going to have to be the one who kind of has to decide, do they still want to take it? Now, again, mind you, if this is the first time you see me, I've talked about this before. We have a lot of people who don't like taking vaccines, whatever reason, right? I don't know if those same people are still going to be on the boat of not taking vaccines. I don't know if this is something that's going to change their heart, but I mean, we'll see. But if they don't like taking the flu vaccine, let's say flu vaccine, for example, right? Which is proven to be very, very, very safe, right? Now you're proposing them to take a virus for the vaccine for the coronavirus, which I couldn't even promise you is very, very safe. I'm not sure. Like, it's definitely something that we would have an issue with compliance in and of itself. Perfect example. I love that. I'm not sure who Agent 5577 is on Periscope, but they're asking about South Korea. So South Korea, very interesting enough, was diagnosed with the coronavirus. Their first patient was diagnosed around the same time our first patient was diagnosed. But the problem is, when in South Korea, when they said social isolation, when they said we're going to do testing, when they said they're going to do those things, they actually did those things in South Korea. Unfortunately, here in the United States, we did not do those things. And that's, again, another part of the reason why the numbers are where they are today. Because, again, we unfortunately, I don't want to say brush it off, right? Well, we kind of did, right? We kind of brushed it off. We weren't prepared for it. We've never had the public health structure for it, right? Because, our government typically doesn't put public health on a high pedestal. So we didn't have the foundation to be able to say, like, all right, everybody, social distancing, stay at home, cancel events. We didn't have that process there until it was too late, right? Until sporting seasons were canceled, until conferences were canceled, right? Until the death numbers rose from that standpoint, right? So definitely an issue of concern there. Let me see. All right. So I want to share the CDC's page, right? Again, I tell all my patients and my residents all the time, right? If you can only choose one website to go to, right, to say, like, hey, where do I get my coronavirus information from? Like, I would say choose the CDC if you had to choose just one. So I want to show, for example, just to get a quick foreshadowing, on March 12th, when we did this live stream, when we did episode 67, the numbers were 968 cases here in the United States. The numbers were 968 cases here in the United States. So I just want to kind of give you a kind of a foreshadowing of what those numbers are right now. All right, and you should be able to see my screen, and I'll even make that bigger. As you can see, right, from March 12th, right, to we are April 4th, the numbers are now 277,000 cases here just in the United States. Not even 4 weeks later, that number jumped from less than 1,000 to 277,000. Now, again, if you watch episode 67, you aren't surprised that the numbers jumped up, because I talked about a couple of reasons why. I talked about the fact that we weren't testing everybody. We couldn't test everybody, even if we wanted to. And unfortunately, because our response was slow, I knew there was plenty of people in the country that was walking around with it who did not know and was giving it to everyone else, right? So we are not surprised by this number. Let me take that back. We should not be surprised by this number, right? We should not be surprised that this number jumped up. I am actually surprised that it jumped up as high as it did, right? I'm on record as saying like, oh, you know what? Right now it's 968. I think it'll probably be about 5 to 10,000 by the end of the month. It got to 5 to 10,000 within 1 week. Like less than a week happened, and it got to like over the 10,000 mark, right? Just to show you how bad like I called it. And again, this I love this website. It's great. Again, it usually updates on a daily basis. Again, around 4 p.m. So again, this number, this 277,000 is going to be higher by the end of the day. And again, it breaks down a state by state, just depending on where you're at, where you're living, and kind of gives a nice little color coded response as far as like who is affected. Now, of course, the darker colors indicate the more affected cases, right? So that's where you see Florida is up there. That's where you see California is up there, Washington, Oregon, New York, of course, right? Again, let me just, I don't know if you can see this number here, just so we can kind of see how significant the lack of public health protection has been. New York has 90,000 cases. Again, that's a low number because they literally can test everybody if they wanted to. 90,000 cases, right? So again, this is, and I know a lot of people are thinking this is something that's going to kind of go away. I love this graph too, right? Because this graph kind of talks about, and this is kind of, we did our live stream here, right, around this part of the curve. And again, you guys have seen the graphs on social media. You've seen the flatten the curve. You've seen the flatten the curve. And again, and that's why we're trying to tell people like these numbers are just going to get worse, right? We know the numbers are just getting worse. So again, you can see just how quickly this number has jumped, right? It went, when we recorded, it was the 12th. Like I said, it was about, at that time, the 1,600 at the end of that day. And right now, right, 277,000 cases, right? So this is hugely important to understand just the severity of it, right? It's again, I don't want to downplay it, right? I don't want to I don't want you to think that like it's going away anytime soon, or I don't want to talk like I'm talking in hyperbole, right? Like this is the most deadliest disease ever, because it's not the most deadliest disease ever. It's just so many people are going to get it, right? And they're getting it at such a huge spike of time that our hospitals, right, cannot deal with it. Our hospital settings, right? Again, our businesses, right? Our outpatient offices, like the amount of services that are being affected. Again, imagine if you're a surgeon right now. If you're a surgeon right now, you can't even do elective surgery on your patients, right? Because hospitals aren't even allowing you to do surgery on your so again, just to give you an idea, like there's not a system that's going to be affected, especially in healthcare, that's going to be affected with this. As a hospitalist, I'm going to be plenty busy, unfortunately, to the year on end, right? Like again, we would assume like summer was going to be like a dead time and kind of slow down. If this virus has made sure that that's not going to occur, and I want you guys to hear this first. We're going to see I'm not even sure where the peak is happening. We're going to see a peak. It's going to go down, and then it's going to come back up again, right? I expect it to come back up probably around the winter time, right? So just so no one's like shocked or surprised when that occurs, right? Just so no one's shocked or surprised. Like I want you to be aware that will occur with this virus, right? It's going to dip down. People are going to, they're going to open their doors again. They're going to be able to go outside again. And then it's going to pick right back up again, right? Fortunately, what I'm hoping, right? And let me take that back. What I'm hoping is that by the time it picks back up again, we'll be so prepared for it that we won't be scrambling like hospital settings are scrambling now, right? We won't be, in a level of panic, right? We won't be as ill prepared as we were and kind of are as we speak for it. And now that leads me to the state of Florida, right? Again, of course, obviously I'm biased, right? Obviously I'm biased because I'm in the state of Florida. I'm a Florida resident my whole life. Again, last week, right? Last week, our governor, right, essentially went on the air or where I forget where he was at, right? But essentially saying that he had zero plans to having a mandate to keep close businesses and keep people off the beaches. And I'm pretty sure you guys have seen on social media all of those spring break and all of these beach fronts that were crazy packed with not only locals, right, but also visitors coming down, crazy packed, who will and who have already done so, taking the virus back to their homes. Our governor refused, right? He was like, nope, if the president doesn't say anything, I'm not going to say anything, right? And I made it a point, right? Because again, I follow him on social media as well too. I wanted to just so we can all see the tweet that he mentioned, especially at the time that he mentioned it. So this is him here. In fact, oh, you know what? Let me see if we can share the audio as well, so you can actually listen to what he was saying.
Some people have said, well, we just see New York, they've issued a shelter in place for the entire state. Shouldn't Florida do that? And I think given our circumstances, that would not be advisable. It would be a very blunt instrument. When you're ordering people to shelter in place, you are consigning a number, probably hundreds of thousands of Floridians, to lose their jobs. You're throwing their lives into potential disarray. And if that were something that were necessary statewide, because the health comes first, that would be one thing. But if you look at Florida's situation right now, this is not a virus that's impacting every corner of the state. We have 20 counties that have 0 cases at all. And we have about 25 counties that really have only a few cases. Some have 2, some have 5, some have 7. You do have an outbreak in Miami-Dade and Broward counties, but those are different from places like Northwest Florida.
All right, guys. So that's what he said, right? That's what he said on March 23rd. And again, if you look, at that time, I even made a note, because I made a note on Twitter. We had 1,171 cases at the time, right? I made it a point because clearly this is a person who is ill-informed. I knew he was ill-informed. Again, if our president's ill-informed about the public health severity of the disease, I already knew our government and our governor likely would, right? So at the time, he was like, guys, there's nothing to worry about. We don't need to shut down. March 23rd. And now I just want to so that was 1,100 cases. We'll just round down for him, right? We'll just round down. There was 1,100 cases on March 23rd when he said that nothing to worry about, no need to shut down. Everything's okay. We'll be okay here in the state of Florida. And then so let's see. And again, this is another site, especially if you're in the state of Florida. This site actually talks about kind of focuses strictly on the state of Florida. Again, this is Florida Health COVID-19.gov. So if you're in the state of Florida, this is the site you want to go to for all of your COVID-19 related needs. So this is the number of cases now, right? Since March 23rd, where we only had 1,100 cases, we now have 11,000 cases, right? Again, I'm rounding down for him. 11,000 cases since March 23rd, when he said nothing to worry about. When he kind of mentioned something is happening in Broward indeed, but he said nothing to worry about, right? So again, this is the situation that happened in Florida. And the only reason why this is not getting as much fanfare as it is because the state of New York has 90,000 cases, right? That's really the only reason why this isn't getting much fanfare as it is. Now, I will tell you, as we speak, he's had to retract those words, and he has had to enact a stay-at-home order, which he should have enacted on the 23rd. And again, I don't know how many lives have been affected by not doing so, but I'm pretty sure there's plenty of lives that have done so. And again, really, guys, that's really the crux of it all, right? Like that's really the concern that we have kind of going forth, right? We have this disease that again, you're going to hear people like me, you're going to hear plenty other people smarter than me, right? Tell you like, guys, we really need to be worried about this. And I hope, right, like that things like this, right? And I'm going to be I'll probably do this on like either a 2-week or a monthly basis, just kind of giving you an update on what's going on. Again, remember, like as April 4th, it's 277,000 cases total, again, rounding down, 11,000 cases in Florida, again, rounding down. So I want you to kind of think about those numbers when I come back in a couple of weeks and say like, hey, this is what's going on now, just so you guys can kind of get the idea that this is a disease that, again, all we ask you to do, right, is try to stay home as much as possible, stay away from people as much as possible. And if you got to come to the hospital, of course, we're not telling you don't come to the hospital, but understand that it's not going to be like a quick in and out, right? Like it's just not. Like I said, at that 15-minute test just got approved last week, right? And there is going to be rationed, right? Not every facility is going to have that 15-minute test because they don't have the again, more technical stuff. They just don't have the ability to test with those reagents, right? Again, it's not like a simple swab or blood and boom, it goes. No, you need like specific things to occur. And that's not even, and again, I won't even talk about here. That's not even the fact that like, hey, like, especially the test to even test a person positive or negative. We have some patients who are coming back and it's telling me indeterminate, AKA, I don't know, maybe not, right? So imagine doing a test, waiting, we'll just say the quick time, waiting 48 hours, 72 hours for this test. And it says, hey, I'm not sure. I don't know. You do it for you. So again, it's always going to be the clinical aspect of it. And you're seeing some of the different remedies that are out there, but it's still so early that there's not enough evidence to say one medication is going to be the home run hitter for this virus, right? That's why a lot of people are ending up intubated. That's why because it's more of a supportive care, a time and prayer, right? And that's what I send to all who's watching, all your families who are watching, all who may be affected in the future, right? That's all we can do is send hope and prayer that if you do get affected with this virus, right, that you make it to the other side. Because again, about right now, the numbers are about, let me go back to, 277,000 total, about 6,500 deaths, right? So again, it's not like it's killing 50% of people get it. It's not like this, deadly Ebola type disease. It's not that. Right. But it is a disease that, again, 5% is still a lot of people. Right. 5%, just to give quick numbers. The flu is like 0.1 to 0.5%. Right. Just so you guys can get an idea, because I know a lot of people like to compare it to the flu of how close that is. Right. 0.1 to 0.5% of people who get the flu will die. Right. And a lot of that is just old age, comorbidities and everything else. This disease right now is killing 5% of the people. And we're just hoping that those numbers will downtrend as we're able to test more, which I do expect it to occur. I do once everybody gets a way to efficiently test this disease, I do expect it to go down. But right now it's just more of the hope and prayer, guys. So that's the end for me. Again, that's about 30 plus minutes or so. I'm yours truly, Dr. Barry. Again, board certified internist, founder of drbarrypierre.com, program director, director of medical education at Wellington Regional Medical Center. This is my second update on the coronavirus. It's probably going to be second of like many to come. If you want to follow me, depending on where you're watching this at, like I said, we are streaming on a whole bunch of different places. It looks like on Facebook, on YouTube, on Periscope. You can text Dr. Barry to 44222. You get on my listserv. You'll know when things are happening. You know when I'm doing things like this. And we'll just pray, man. You guys be blessed. Have a great day, and talk to you guys later.